Good afternoon. Today is April 18th, and today I will continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about today is that a new crisis has been seen in COVID-19 patients, which is providing dialysis. So, evidence is mounting that in addition to respiratory complications, the coronavirus is also shutting down some patients' kidneys, which is posing yet another series of life and death calculations for doctors who are already in shortage of ventilators. It is not known whether kidneys are a major target of the virus, but kidney specialists estimate that 20 to 40% of patients in intensive care suffered kidney failure and needed emergency dialysis. This is extremely worrisome because now there's a growing demand for kidney treatments, which will become a major burden for hospitals because they need special equipment, special trained nurses, as not every hospital has so many dialysis centers. Since dialysis is usually provided in special centers, now with the growing number of patients, this poses as yet another threat, and hospitals said that they have called on the federal government to help prioritize equipment, supplies, and personnel for the areas of the country that most need it. The second thing that I'd like to talk about today is that to reopen the country, an estimate by researchers at Harvard University suggests that the United States cannot safely reopen unless they conduct more than 3 times the number of coronavirus tests it is currently administering over the next month. So an average of 146,000 people per day have been tested for the coronavirus nationally, and on Friday reported 3.6 million total tests across the country. To reopen the United States by mid-May, according to the Harvard, an estimate of 500,000 to 700 daily tests will have to be performed. Currently, about 20% of those who tested so far have been positive for the virus, which is a rate that researchers say is too high. So if you have a very high positive rate, it means that there are probably a good number of people out there who have the disease who you haven't tested, and you're basically just going to have to retesting the same people. And you want to drive the positive rate down so that the fundamental element of keeping our economy open is to make sure you're identifying as many affected people as possible and isolating them. The third thing that I like to talk about is how women are working in central jobs but are often undervalued and unnoticed. So, according to a New York Census report, about 1 in 3 women work in an essential job. Almost 9 out of 10 nurses and nursing assistants are women. A majority of pharmacists and an overwhelming majority of pharmacy aides and technicians are also women. More than 2/3 of the workers at grocery store checkouts and fast food counters are also women. So, in normal times, men are a majority of the overall workforce, but in a crisis like this, it has completely flipped, and now women are completely the necessity workforce. Men make up a majority of workers in a number of essential sectors, including law enforcement, transit, and public utilities, but most women work in the industry at the forefront, healthcare. There are 19 million healthcare workers nationwide, nearly 3 times as much as agriculture, law enforcement, and package delivery industry combined. And what's sickening about this is that the CDC found that 73% of U.S. health workers who have been infected since the outbreak began were women. So clearly, we can see that just women are being overlooked. They are often undervalued, and yet the people who are working at the front line are often women, and they have also taken the price for that. Many health workers say that they have been long undervalued and neglected for sectors beyond healthcare and encompassing a vast army of people who tend to the young, old, sick, and infirm. basically, now that they're being identified who are the essential workers, it's basically just all women, and still at times like this, there are men who still degrade women, and these women are often not well compensated, and even not even noticed, and most workers are also non-white, and basically this just points the huge flaw in society where we're overlooking the essential workforce, which is women. That's it. Thank you for listening, and I hope you have a good day. Thank you.